Metro Police are getting sued. Attorneys for sound engineer Mark Capps' family says that officers used excessive force and unreasonable force. Though the Tennessee Bureau of Investigation recently cleared the Metro SWAT officer who shot and killed Capps. Now, in January, Capps reportedly held his family at gunpoint in the middle of a mental health emergency. So, why weren't mental health co-responders sent to the scene? News 2's Adam Mincer went digging.
Hours before this moment, Mark Capps' own family went to police, saying Capps was holding them at gunpoint. But when Metro SWAT went to serve Capps a warrant for assault and kidnapping, Capps' family attorney says in a new lawsuit he was in the midst of a mental health emergency after the death of his brother. And police went too far. The lawsuit denies police's claim Capps had a gun in his hand. The lawsuit also questions why MNPD didn't send mental health professionals to the scene. Capps' family attorneys writing, rather than utilize a partners in care team, MNPD sent a SWAT team in to deal with Mark, with predictable results. MNPD must now be held accountable to Mark's family for this preventable disaster. In the lawsuit, the attorneys say this isn't the first time a Metro officer has killed someone in a mental health crisis, mentioning this moment from 2022, when officers found Landon Estep on the side of I-65 with a box cutter in one hand and his other hand in his pocket.
That's a gun. What you got in there? Don't worry about it. We'll figure it out. We'll fix it.
After 30 minutes of negotiation, police say Estep pulled out a silver cylindrical object that ended up not being a firearm, but officers opened fire. After his death, Estep's wife said she wished a mental health professional had been on the scene.
People struggle with mental health and people are too afraid to talk about it or too afraid to implement things.
At the time, Metro Police's partnership with the mental health cooperative called Partners in Care wasn't up and running in that part of town. In January, we asked the mental health co-op if a co-responder would have helped that day.
Every situation is unique, and of course that I-65 situation is incredibly tragic with the outcome, but we have had, similar situations where individuals have been, threatening themselves and potentially threatening others and had a weapon or had a weapon close by, and we've been able to de-escalate. First and foremost, we have to make sure that everybody's safe on the scene, and I can't say that a clinician would have been pushed into that scenario.
But a spokesperson for Metro Police said today they weren't aware of a situation where a co-responder responded to somebody with a weapon. When we asked to see the written policy of when Partners in Care is deployed, Metro Police said these policies are vague because the mental health co-op isn't a part of MNPD. In Nashville, Adam Mincer, News 2.
A Metro Police spokesperson did say they will send us the policy once they get it from the captain involved in this partnership. We haven't received it yet. They also emphasized they would not put an unarmed civilian like a co-responder in a situation where someone is armed. The mental health co-op also didn't send over their policy or a statement addressing their policy.